今天，湖北省新冠病毒肺炎疫情防控工作指挥部
Good afternoon.
召开第78场新闻发布会，介绍统筹推进疫情防控
Welcome to the 78th press conference organized by the Information Office of Hubei Provincial People's Government. Today we'll brief you on the situation on coordinating epidemic prevention control with the economic and social development. With us today, we have Deputy Governor of Hubei People's Government, Mr. Yang Yunyan, Deputy Mayor of Wuhan Municipal People's Government, Mr. Li Qiang, Deputy Director of Hubei Health Commission, Mr. Liu Dongru, Deputy Director of Hubei CDC, Mr. Li Yang. First, let's give the floor to Mr. Li Yang for the latest epidemic update in Hubei Province. As of midnight of April the 18th, total number of confirmed cases reported in Hubei Province stand at 68,128, 50,333 in Wuhan City, 17,795 in other cities. As of midnight of April the 18th, number of new confirmed cases in Hubei Province, 0. No imported cases reported in Hubei Province. The whole province has registered no new confirmed cases for 15 consecutive days, except for Wuhan. Other cities reported no new confirmed cases for 45 days. As of April the 18th, 109 patients are still hospitalized, 6 in severe condition, 16 in critical condition. As of April the 18th, total deaths reported in Hubei, 4,512. On April the 18th, no new deaths reported. As of April the 18th, total number of cure and discharge cases stand at 63,507. On April the 18th, 13 people discharged from the hospital, all coming from Wuhan City. On April the 18th, newly added asymptomatic cases, 22. None of them developed into confirmed cases. 35 people removed from quarantine. 576 asymptomatic patients are still under medical observation. Now let's give the floor to Mr. Yang Yunyan to brief us on the epidemic prevention and control, as well as the economic and social development. As of April the 17th, Qiaokou district has been adjusted to low risks. Right now in Wuhan City and Hubei Province, in general, we are identified as the low-risk regions. We have lifted the travel restrictions on March the 25th for Hubei, and also we lifted the travel restrictions in Wuhan City on April the 8th. Hubei Provincial Government have strictly followed the guidance made by General Secretary Xi Jinping, and we follow suit the deployment from the CPC Central Committee. We earnestly implement the general guidance to prevent the import infection and domestic resurgence. We are responding to the call of the Provincial Prevention and Control Commanding Center. We are making sure all the measures can be implemented in a detailed manner. Now the epidemic situation is improving right now. We have to consolidate this hard-won achievement. On one side, we have to focus on the prevention and control at community level. We have to focus on the work of the communities, and the inspectors and volunteers will form an inspection group, and they will ask all the people who are visiting the communities to make sure that these people are wearing their masks, and also these people are not carrying any virus into the community. We have to take science-based approach on the prevention and control work, and we have to clarify the responsibilities for different parties. We need to adopt a traffic control measure and to reduce the risk of cross-infection. Second, we have to strengthen our management for the key groups. We have to do epidemiology for the key groups and the 4 types of people in Wuhan City. And also we have to run this kind of testing in some public facilities, for example, shops and restaurants. And In the nursing homes, we also need to run the IgG testing for these workers. For teachers, healthcare workers who are staying outside of Wuhan City, we also run the sero analysis for these people. We are making sure that all the suspected people are receiving testing and screening. We will take strict measures on the screening and generate reports to follow up the situation of this group of people. And each day, we will publish this information in due course so that we can cut off the transmission effectively. And third, we will take strict measures to curb the imported infection. We will formulate a closed-loop management for people coming to Hubei from overseas destinations. And also, we will coordinate with other provinces to form a joint prevention and control mechanism so that we can clarify the responsibilities by different provinces so that we can curb the imported infection and prevent domestic resurgence. And also, we will work with different sectors and the Prevention and Control Commanding Center. We will roll out the patriotic health campaign at all fronts. The Health Commission will organize the expert group to visit the key regions and facilities to provide trainings and guidance so that their capability of prevention and control can be enhanced. For different communities, they have also taken a series of measures to improve the awareness of these people who are staying in the communities, so that the people can remain vigilant and never slacken off in their efforts in the containment. Going forward, we will continue to follow the important speeches made by General Secretary Xi Jinping and consolidate the hard-won achievement we have made in the past few months. We will remain vigilant and make relentless efforts to fight against the COVID-19. We are still holding up to the highest standards and spare no efforts to prevent imported infection and domestic resurgence. We have to get prepared for a normalizing prevention and control in our province. We have to focus on some of the key issues. For example, we will manage the asymptomatic patients or people in different public areas. We have to make sure that all people can receive testing as required. And also, we will run screening during the process of work resumption, and we will strengthen our closed-loop management for the epidemiology investigations so that we can fill all the loopholes to prevent the domestic resurgence. For asymptomatic patients and their close contacts, we will bring them to quarantine and run tests for all of these people. And also in the community, we have to make sure that we are normalizing our epidemic and prevention work so that the order can be restored at an earlier date. We also provide classified and targeted measures. We have to make sure that we have to gather all the information for people who are coming to Hubei from other countries and province. And also, we will provide support for the restoration of the social order and the economic order. We have to prioritize the work of stabilizing investment and stabilizing the economic development. We will also improve our environment and the services and strengthen our efforts to receive investment and develop the digital economy as well. We will find more growth factors for the economy so that we can strike a balance between the epidemic prevention control and the economic and the social development. Thank you. Now is the Q&A session. Please identify yourself before you raise the question. With Economic Daily, my question is on April 18th, Wuhan has been adjusted down to low-risk regions. In Hubei Province, there's no high and medium-risk regions. Under such circumstances, so what other measures will be taken by Hubei Province to consolidate our achievement? Thank you. Thank you for your question. Right now, the epidemic prevention and control in Hubei Province is improving, and we have made important progress. Start from April 18th, all the cities in Hubei Province is identified as low-risk region, but still we have to focus on prevention of imported infection and the domestic resurgence. We have to fulfill the task to normalizing our prevention and control work, and we have to ensure that we have a detailed implementation of the measures. Especially, we have to focus on the prevention and control for the key groups of people and key public facilities. First, we have to strengthen our management for the community, and this is the first defensive line for us to implement the joint prevention and control. We will work with the inspectors and the properties so that we can form a team to strengthen our prevention and control work. For people who are coming into the communities, we will ask their identities, check their body temperatures, and making sure that these people are wearing face masks. And also, we will educate the residents to reduce the non-essential travels so that we can cut off the transmission routes. And second, we have to evaluate the risks. For example, in some public areas, for example, the pubs, KTVs, recreational areas, swimming pools, and some indoor places. And for all of these recreational places will be closed temporarily. For wet markets, hotels, we have to take some measures to restrict the number of people, and also we encourage people to shop online so that we can reduce the gathering for the people. In airports, train stations, terminals, we have to allocate more resources, open up more service channels so that we can reduce the waiting time for the passengers. Third, we will continue to manage the asymptomatic patients. On top of our screening work for the asymptomatic patients, we have to do more to conduct testing to all of these asymptomatic patients. We will take effective measures and bring these people into our health management system, and we will track down on the travel history of these asymptomatic patients, and we will bring these people into medical observation. Fourth, we will strengthen our efforts to manage people who are coming to Hubei from overseas. We will make use of the big data to monitor the travel history for these people. We will conduct a large-scale screening for all of these inbound travelers. And also, at the same time, we will report the information of these people back to the commanding center. And for the 4 types of people who are entering into Hubei Province, we are making sure that all of these people can be screened as required. We will do whatever we can to fill the loopholes so that we can prevent the imported infection and the domestic resurgence. Thank you. Next question, with China Daily. With all those efforts, Wuhan has been identified as the low-risk region, but it doesn't mean that there is no risks in Wuhan city. So what other measures will be taken by the government to ensure a good and sound prevention and control in Wuhan? Thank you for your question. The epicenter, Wuhan city, has been adjusted to low-risk region on April the 17th. Start from March the 18th, we have zero increase of suspected cases, and also we have zero confirmed cases for over 14 days. And as of now, over 14 days that asymptomatic cases turned into confirmed cases. This is thanks to the leadership of the Central Committee, and also this is thanks to the joint efforts made by all Wuhan residents. We are waiting for this day for a long time. Recently, we found some resurgence in other cities of China. It also reminds us that we still see some increase of the number of asymptomatic cases in Wuhan, and also we have more people coming to Wuhan city from other cities. So in coping with the current situation, the Provincial Prevention and Control Commanding Center issued a document on standardization of the normalizing prevention and control work. So first, we will strengthen the territorial responsibility in the communities in Wuhan city. We have volunteers and workers from the properties, and these people will form a team to normalizing the prevention and control work of the virus. And also we will continue to strengthen the close-off management for some communities. And for people who are coming in and out of the communities, these people have to wear masks and get their body temperature checked. We will also provide education and guidance to the local residents to reduce the number of non-essential travels. And also, we will do what we can to adjust the transportation to meet the needs of the residents. And also, we will take targeted measures to improve our efficiency of the screening. Especially, we will focus on people coming to Hubei Province from overseas, and as well as the asymptomatic patients. We're making sure that we can make rapid response, and we will pay attention to people with difficulties and the people who are living in nursing homes. When necessary, we will offer assistance to this group of people. And fourth, we will continue to roll out the patriotic health campaign so that we can help our residents to raise the awareness of health management. When necessary, we will publish the current epidemic situation to the public so that our people can remain vigilant and never slack off in their efforts in the prevention and control. And also, we will formulate a series of guidance to key areas to guide them in the prevention and control work. We strengthen our efforts in normalizing the prevention and control. For example, we will focus on the districts, communities, and we will give full play to the role of the community in fighting against COVID-19. We will clarify the responsibilities for these communities, and we will set up a supervision mechanism to make sure that all the policies can be implemented in a detailed manner. Thank you. Next question, please. With the paper, start from April 18th, Wuhan has been adjusted to low-risk region. I believe many people will go back to Wuhan city, and the business resumption will be accelerated. So my question is that what other measures will be taken by Wuhan city to prevent the domestic resurgence? Thank you. Thank you for your question. As of now, the epidemic prevention and control work in Wuhan city is improving. We will run NAT to key groups of people. And for the other group of people, we will also closely follow their situation. This is actually a task assigned by the CPC Central Committee to us. Last month, the Central Committee has issued a paper to strengthen the management of the asymptomatic patients. In order to consolidate our achievements that has been made in the past few months, we will continue to increase the amount of nucleic acid tests so as to meet the needs of the residents. Right now, we have 189 NAT laboratory, which have already covered all cities in Hubei Province. So on a daily basis, we can check 54,000 people per day. In the past, we can only test 304,000 people. On April the 14th, the capacity of NAT testing can reach 89,000 people per day. So this is a key task for us. We will do the following 5 jobs. And first, for the key groups, we will bring these people to NAT testing when necessary. Especially, we will targeting teachers, healthcare workers, and workers in restaurants and shops, as well as elderly people in the nursing homes. And also we will run the nucleic acid test to those people who are about to go back to their position to make sure that all people can receive these testing as needed. And for individuals and enterprises, if they are willing to take the test, we will do what we can to fulfill their needs. We will also analyze the local situation. For example, if people who will leave Hubei Province and had visited overseas destinations in the past 14 days, we will also provide this testing to these people. And the second, the Provincial Prevention and Control Commanding Center will publish a list which listing all the available testing centers so that the people can choose the most adjacent testing centers to receive the nucleic acid test. And also we will improve our resources to support the sampling and the testing center to make sure that we can reduce the waiting time for the residents who are willing to receive the nucleic acid test. For the third-party agencies, they also roll out the appointment system so that they can meet diversified needs of the residents. Fourth, for a specific group of people, we are making sure that every one of these people will receive the nucleic acid test. For example, people who are staying in the fever clinics, we will run the epidemiology investigations for these people. If we identify any suspected cases or confirmed cases or close contacts of some of the confirmed patients, we will again run the nucleic acid test to all of these people. Fifth, we will strengthen our reporting system. If they identify any asymptomatic patients or patients with COVID-19 virus, we will strengthen our work to implement the 4 early measures. We will report these cases immediately to the commanding center. And for the individual cases, for example, these asymptomatic patients or confirmed cases, these people will be transferred to designated quarantine points or designated hospitals for further treatment. And third, for CDC and different levels, and they will conduct the epidemiology investigation to these 4 types of people. And fourth, we will track down on the close contacts of these confirmed and suspected cases, and also we will roll out the disinfection to those public places. One last question. With Yangtze Cloud, COVID-19 has brought big impact to the economic and social development in Wuhan. So what work will be done by Wuhan City to normalize the prevention and control as well as the restoration of the economic and the social development? Thank you. Thank you for your question. Indeed, COVID-19 has brought severe impact to the economic and the social development. Right now, our focus is on coordinating epidemic prevention and control with the economic and social development. We will strictly prevent the domestic resurgence. And also, we are implementing the 4 must measures in different communities of Wuhan City. We will roll out the large-scale screening to enterprises in Wuhan to make sure that we have a dynamic management to all the suspected people, and to restaurants, parks, shopping malls, and hospitals. We will continue to monitor the temperature for people who are going in and out of these places. As of now, we will suspend all the services in some of the recreational sectors. We will also manage the situation of the fever clinics to make sure that all people who are coming to the hospitals could register their information. We will strengthen our NAT testing and improve our capability in the NAT. Now we have 211 testing points, so on a daily basis we can run NAT tests to over 46,000 people per day. Once we found any asymptomatic patients and confirmed cases, we will transfer these people to designated hospitals. And also we will prevent imported infections. For example, in transportation hubs, train stations, airports, we will register these people's information. We want to make sure that we can track down on the personal information to all the passengers. We will also establish a special task force so that we can bring some of the people going back to Beijing when necessary. We will take proactive measures to track down on the people who are coming back to Hubei from overseas destinations. And also, we will follow up on the information of these people. If these people had visited hospitals, we will follow up on these people's travel history to make sure that we can manage every link of the transportation of these people, so that we can get the full knowledge about the travel history. For people who are coming back to Wuhan or leaving Wuhan, we will take measures to manage these people to make sure that this virus will not be transmitting to other people. The work resumption in Wuhan is a little bit lagging behind compared to other cities. We will take proactive actions. Right now, the business resumption is better than our expectation. For the resumption rate of business above designated sizes, the resumption rate is over 93%. Also, we have 2,800 companies above designated size, and the resumption rate is 87%. In the service sector, number of enterprises is 3,000. The resumption rate is 96.1%. For the wholesale industry and the catering industry, we have 2,941 enterprises. The work resumption rate is 87%. For the construction companies, we have over 1,750, and the resumption rate is 86.5%. And the real estate companies, the resumption rate is 99.9%. Going forward, we will continue to strengthen our work in the normalizing the prevention and control, and also we will focus on the goal of the annual economic and the social development to make sure that we can fulfill the safe stability target set by the central government. On one hand, we will focus on the business resumption, and also we will focus on improving the capacity of these enterprises. We will offer necessary support to these enterprises for the restoration of their business. And for the life supporting business, we will offer necessary support for them for the business resumption, so that we can continue to make contributions to improve the economic and the social development in Wuhan City. By doing all of that, we can stabilize the employment and also resolve the challenges that has been faced by all of these enterprises. Second, we will alleviate the burden from these enterprises. We will reduce some of the tax burdens for these enterprises, and we will boost the confidence to the SMEs and the small and micro companies. On February, there also a document that has been released by State Council to support the SMEs and small and micro enterprises, and we will fulfill all of these policies, and we will follow a results-oriented approach to do what we can to resolve the problems faced by these companies in restoration of their business. And the lending support has been increased from 20 billion to 40 billion yuan. And also we will create a favorable condition for all of these enterprises for their business resumption. By doing all of that, we can provide a 24/7 services to all of those enterprises. And the state-owned companies will take the lead and to reduce the rental fees for the SMEs as well as the self-employed business, and the tax bureaus also provide tax subsidies and benefits to all of these companies. And third, we will provide more support to key projects, especially focusing on the transportation and infrastructure projects. We will focus on the 283 key projects in Wuhan City. We will follow through the deployment from the central government, and will follow the requirement that has been assigned from the 14th five-year plan, so that we can strengthen our work to implement all of these projects. At the same time, we will issue the consumption coupons, and also we will open up a series of new business models online. And also we will provide a lot of new AI scenarios so as to promote the consumption. Fourth, we will provide more tax and fee subsidies to the enterprises. We will fill out the weak links in our city, make sure that all of these key projects can be approved by the government. We will set up time schedule to make sure that all of these projects can be implemented in accordance with our plan. For approved projects, we will open up green channels and will give special treatment to all of these special cases. We will streamline our approval process to make sure that once the project is approved, that these projects can be implemented immediately. Make sure that all the funding support can be put in place for all of these key projects. Fifth, we will also offer subsidies and support to people with difficulties. For these people, will be included into our insurance plans. When necessary, we will offer one-off subsidies for these people. And also, we will suspend our verification for people, the low risk, for people in basic living subsidies program. And also, we will once again verify their income level, start from July, and the subsidy will increase by 830 yuan. And also, we will increase the basic living subsidy for these people who are living with difficulties because of the COVID-19. And also, we will offer pricing subsidies to people in hard-hit regions. And also, we will strengthen our subsidy to people with disabilities, and the subsidy will be increased by 50 yuan per day. And also, we will strengthen our work to support the employment, provide more trainings to people, and encourage these enterprises to open up more jobs to the public. Thank you. Thank you, all the speakers. Once again, thank you all for your questions. That's the end of the press conference.